Practice health system. This afternoon, I thought that the issues at hand are serious enough to disrupt your Sunday so that we can come and have a very honest and frank discussion. I've had the opportunity to sit in almost every morning in a meeting that has to do with our healthcare system. And it's become very obvious and clear to me that healthcare system, particularly the state healthcare system, has collapsed. I don't need any more evidence. I have taken time out. I have sent people discreetly across all aspects and all our healthcare facilities in the state. And so whatever I'm saying here today comes from a position of personal information. This is not hearsay. It is what I have seen myself, not only physical facilities, but with a broad spectrum of you practitioners in our healthcare system. The reason why I have come to discuss moving forward with you is that we have no other option. We have come to the end of the road. And I think this is the first time since 1984 that you'll be having a fundamental shift in the healthcare system in our state. I contested elections and I went across it. And it was clear to me as I went around that the people of the state Edo State spoke loud and clear that they want a change from the past. Because if not for the people, I will not have won the elections. So from that perspective, I have no fear, I have no inhibitions in making the changes that we need to make for the benefit of our people. I said we have come to the end of the road because moving forward, we have now introduced the compulsory health insurance scheme for all Edo citizens in Edo. And I cannot justify collecting premiums from people when I am not able to offer them healthcare services. I cannot. So we are making that fundamental shift from a thinking where healthcare was solely the domain of government to one where healthcare has now shifted to the individual. So the system and structure we operate has to change. We see the healthcare system in Edo as one. Because when you are sick, when you are ill, it doesn't matter where you get treatment from. It doesn't matter whether it's a federal facility. It doesn't matter whether it's a state facility. It doesn't matter whether it's a private facility. It doesn't matter whether it's a local government facility. The key for you is that I want treatment, I want to get well. So from that perspective, we will not discriminate. The health insurance scheme we've just introduced does not discriminate. Once you have your card, paid your premiums, anywhere you go in Edo State, you must be able to get service. That is the implication. That is why I said we have come to the end of the road of the old order. Moving forward, it cannot be as it used to be. What are the key features of the change? You have been discussing amongst yourselves. First, government will now focus on its key role in healthcare, which is to create policies and to regulate the healthcare system. So it doesn't matter whether you're a teaching hospital, you're a state government owned hospital, or a private hospital, or local government, that the standard you need to keep in Edo has to be the same and will be regulated by the ministry. The ministry does not have any business managing any hospital anymore. All our hospitals will now operate like any other hospital, like any private hospital, because the citizen has a choice of either coming to our hospital or going to spend his money in a private hospital. So our standards must be higher than that of private hospitals, because we have more money as government to invest in the healthcare system. We've seen it in education, where we have improved efficiency and parents are moving their children from private schools into government schools. Whereas that was not the case before we made that change. So moving forward, you have maybe 3 weeks to organize the system. I send people to Igara. There's one doctor in Igara, only one doctor. And how many doctors are sitting in specialist hospital Benin? How many? And what are they doing? We have tabs, we have compiled records of people who come in, they don't stay in our hospitals, and they go and work in their private settings. I have enough records. I can prosecute anybody I want to prosecute and get conviction, but I'm not going to go there. And please don't let me go there. We just must make our healthcare system work for our people. Between now and the end of the month, you have to commence the process of reorganizing. Because we've made decisions, we're not going to go back. I cannot go back and say, I will not collect insurance premiums. I cannot go and dissolve the health insurance company we have. We've started, I know you people have been working with the transformation team. Everybody must now account for what they do. There's no hiding space again for anybody. I know it's been the culture to cover up for people. You and the person you are covering up for, you will suffer the same fate. Because with technology, with the systems we're putting in place, we can account for everything you do. And you cannot argue that we do not pay. There has been no month on the 26th of any month that you have not received your remunerations. And I know some of you earn twice what I earn as a governor in terms of salary. But I don't quarrel about it. It's good, it's fair. But please work for it. Earn your pay. Provide healthcare services to our citizens. We refurbished a 300-bed isolation center for treatment of COVID patients, and it's been shut down. Meanwhile, UBTH is overcrowded. You find people on the corridors. Those people who go there, they are Edo citizens. They are one of us. They are taxpayers. But because we have failed to provide services for them, that is where they go and seek care. And those facilities there are overstretched. Ditto in Iroa. So I have sworn to my God that having given me the opportunity to come back, despite all the opposition from the old order, I will change the healthcare system in Edo State. It is nothing personal. I have nothing personal against anybody. But we have no more hiding room. You can't travel abroad to go and get healthcare treatment abroad anymore. People have not been able to. So we are stuck here. That means we must provide the care we go and seek abroad. Some of you live here and go abroad to work. It means you have the expertise. That expertise must now be utilized here if you decide to stay back at home. It is not a threat. It's just reality. The time has come where we have no choice. There's no other way except we all collectively say we want to commit class suicide, and we don't care. And you can see what's happening with COVID. It does not discriminate who. It could be you tomorrow. And if you need help, there will be no system, no structure. That your small clinic may not be able to take care of your requirements at that point in time. So, from just a humanistic standpoint, from the point of the oaths most of you have sworn to, I think it is only proper and fair that we all decide and join in this whole efforts to change the way our healthcare system has worked. We cannot go further with this. We have come to the end of the road of the old system, and we are now charting a new direction. So I've come here this afternoon to appeal to you to join us in moving in this direction. That is the purpose of this meeting this afternoon. I am not going to sit here to begin to talk about the details. I mean, I have had more than 100 hours. I mean, what am I talking? 100 sessions. Sometimes each session is almost 1.5 hours. Just listening to understand what happens in the healthcare system in this state. It is not that we don't have the people. Yes, we may not have enough. But the little we have, how are we utilizing it? It is not that we do not have the expertise. I have heard some young officers, I have heard some old professionals speak. I have seen their work. But the system suppresses them. I have seen corruption like I've never seen anywhere in the system, in the healthcare system. If I decide to charge some people to court, I will lock you up in jail for a long time. Because the records, and when you do these things sometimes, they're so clear, they're so obvious. And it's across the chain. The level of corruption in the health system in Edo State, is just unacceptable. It's like a basket. But like I said, it is not personal. I am not here to end anybody's career. I'm here to appeal to you to say, look, we have drawn the line. Going forward, it's a personal decision to join us to move forward. Or to say, you know what, I'll take a bow. On no account will anybody now refuse postings. On no account will you be asked to go and perform a function and you do it the way you like. No. Because that person, that client, has a choice of going somewhere else because he has already paid for his healthcare service. And all our facilities must now be manned. Permanent Secretary, you're going to sit and anyway, it's not something we'll discuss out here, but we will man all our facilities. Let me now see who wants to work and who doesn't want to work. So that is the purpose this afternoon. After here, we're going to go to Stella Obasanjo. I'm sure many of you haven't even been there to see what's going on there. And it is annoying. It's really, really annoying when people come to want to even assist and then you are trying to frustrate them. And it's top to bottom. It's top to bottom. So I'm just here this afternoon, like I said, to appeal to you. Don't think there's anything going on we do not know. Just doing things. We have enough information from whistleblowers, from people who do deals, people who feel cheated, people who feel oppressed. I have enough dossier. But I have said, maybe it was the old order that encouraged it, but now that we are shifting and we are changing, it's going to be that we will run a system that can survive us, a healthcare system that can sustain us. And by the grace of God, by the time we are finishing in 4 years' time, none of you will ever have need or cause to leave Edo State to say you're seeking for treatment or anybody who is close to you is seeking for treatment outside of Edo State. On that note, I want to welcome you. It's like a mini town hall. We'll take a few questions, and I want to listen to the leaders in the system to tell me or throw some light on some of the key decisions that have been made and how we will go about with the implementation. On that note, I welcome you and say good afternoon.
Thank you, Mr. Governor. State, the SSG, the head of service, my colleagues. On behalf of the health sector, I want to first of all congratulate His Excellency for the overwhelming victory you had in the 2019 elections. I want to just highlight a few things. The achievements of the Edo State government in the health sector in your first tenure and now the second tenure. The first
Yes, sir. Let's not go there at all.
Okay. Yes, sir.
Let's not go there.
Okay,
we should
sir.
stop that nonsense. What we call achievements, then we're done for. Let's not patronize anybody of the system. Let's go to the hard facts. Why is it that we have only one doctor in Igara? How come we have less than 3 doctors in Auchi? How? Now there's a Lassa fever outbreak. There's a threatening what's it called? Cholera outbreak. We have COVID. Our people are dying. You know, nobody in this health system can give me data on mortality rates in Edo State. And you're telling me we have a system that's working? Please, it's either you guys take me seriously or the consequences will be really there. I've asked, in one of our sessions, we said, give us the record mortality in Edo, the people who have died. Are we not supposed to register deaths? Are we not the ones to certify when people die? Meanwhile, the records they gave us of all mortality in all the 34 hospitals in Edo State was less than what is recorded in UPTH in 1 month. Is that a healthcare system? Healthcare system. And this is the kind of attitude that causes it. We're patronizing ourselves when things are obviously bad. I have a pile. I know how many doctors, how many colleagues write to me every day for help. They want to go abroad to go and get treatment. If our own system was working, would they go out? Please, Permanent Secretary, don't go there. Let's focus on what's wrong and let's agree to begin to fix it. That hospital, on a monthly basis, their net income, their gross income is less than 500,000 naira. Meanwhile, in Igara there are nothing less than 20 hospitals. And you can go around and see what each hospital makes that don't have the facility we have in Igara. In Auchi, we make less than 2 million naira a month. There are private doctors in Auchi themselves that we know how much they make. So it's like, is it that we are deliberately killing our own so that other people can make it? Why? I need that explanation. I have all the data for each hospital, and I've done a survey around the area the hospital serves. So we cannot say it's because there's no clientele. It's not because we don't have staff. Those are the things I want us to resolve.
Giving us today We've not had it before. The governor is not telling you that things are perfect from this end. This should have been an opportunity for all of you, the practitioners, those who work in our health system, to take up on some of the things you think or you expect. We have told you what we have observed. And we have said we ask you to come here to assist us to find a solution. So I expect that each and every one of you will have something to tell us as to what should be done so that we fix the health sector. I just thought I should intervene so that we understand the session better.
My name is Osumbo Osareme Augustine. By the grace of God, I am a consultant physician and a nephrologist. I had my specialty training at the University of Benin Teaching Hospital, and by privilege of grace, I had been trained in Hungary under the European Renal Association and the European Transplantation Association. I currently head the isolation center at the Stella Obasanjo Hospital Isolation Center. Now, before the COVID era, when His Excellency inaugurated the multi-level committee to handle the COVID-19 pandemic in March 2020, I was already a consultant nephrologist at the Central Hospital Benin and a practicing physician there. I want to start from there, sir, with your permission. Coming back from UBTH in 2016, I became the third consultant physician that Central Hospital Benin was having in a very long while. The current head of department of the Department of Internal Medicine had saddled that responsibility for a period of an average of 8 years before I qualified as a consultant physician and was appointed at the Central Hospital Benin. Now, not too long, I was made the head of department of the same Department of Medicine, Central Hospital Benin. Now, Your Excellency, please pardon me for these details. I am very sure that it will help us chart a good course forward, especially in the area of rendering specialist services to our own indigenes in the state. Now, like I said, I was appointed as the head of department, so it became very glaring to me the very many challenges that the Central Hospital Benin was faced with. Now, let me begin by saying that I took over medical wards, and currently the medical wards in the Central Hospital Benin for males accommodate a total of 30 beds, and on many occasions there could be spillover into other non-medical wards. What I mean by non-medical wards, I mean surgical wards, and sometimes even the surgical wards, orthopedic wards. And then for the female medical wards, that place currently has 12 beds. In total, the medical wards house or beds is about 42 bedded wards. And on very many occasions, there are spillovers of admissions because on the average every day in Central Hospital Benin, Department of Medicine, we have nothing less than 6 to 10 admissions in the medical wards. And like I said, many a times there are spillovers. And that is how we have managed while I was there. Now, because the medical ward has average of 6 units. The units, they include the medical wards, as I said.
Sorry, Dr. Gumbo, please, can you just go to the point? Are you saying, I mean, there are constraints in terms of bed space? Are you saying, I mean, I can't get where you're headed.
Yes,
right
sir.
now, you are managing the Stella Bassando Isolation Center.
Yes, sir.
Okay, and that is a 300, almost a 300 bed facility, right?
Yes, sir.
That you are shrinking to 100. So is it that people are not coming, or you don't have the space to admit them, or they come, or what exactly is the issue?
Yes, sir.
In your same hospital complex, Edo Specialist ESH, right?
Yes, sir.
You have how many bed facilities there? Right? You could argue in the past that okay, it's because people cannot pay, but right now we have both the healthcare provision fund and we have the health insurance, and I am saying that going forward we cannot accept the attitudes and the complaints you are making now. Going forward, the Edo Specialist Hospital is the minimum standard we will accept from any of our hospitals, and so everything has to be structured in that light. So the excuses we used to make in the past that this one cannot pay is no longer valid because provisions are now being made. So how do we run a first-class nephrology center in our hospitals? Edo Specialist Hospital, you know, they have a renal center there. Has that renal center failed one day? Has it?
Yes, sir. Thank you, sir. Sir, I was coming there, sir. I like I said, I run every Monday nephrology clinic at the Central Hospital Benin, and I have had many occasions to even help the Edo Specialist Hospital review their patients. The records are there, sir. Most of my patients who would need dialysis, I refer them there, and on many occasions I review those patients without being paid by of course I know I'm already a state employee. So without being paid, and the records are there, the doctors there, they will also attest to that fact, sir. Now, sir, let me be brief because time will fail me to really give you the detailed statistics which are in my hands, and let me go straight to the COVID era because that is where we are now, and it's because of the pandemic that the breakdown in the health sector is being unveiled right now, because I can say that it's not only even in the States, even in the developed countries, in the best of nations, there are evidences that there's already a breakdown in the health sector, overwhelming nature of the COVID infection, sir. Now, in the Stella Obasanjo Hospital, when I took over the headship there as the treatment center head, sir, in the first wave, we had a total of over 600 patients that were managed in Stella Obasanjo Hospital. 217 were confirmed. They were admitted, treated, and were discharged. The records are there, sir. They've over 400, sir.
In Edo State, how many cases were there?
That were there.
That simple.
Sir, in the first wave, we recorded...
In Edo State, how many cases?
In Edo State, sir.
Yes.
That's mortality, sir.
Yes.
Mortality in Edo State in the first wave was about a total of 110.
No, those are fatalities, but cases.
Total cases
yes.
of confirmed
yes.
COVID cases.
Yes, in Edo.
In the first wave, sir.
Yes.
In the first wave, there were roughly about 1,300, sir.
No, that is not true.
Confirmed
we had
cases.
in excess of 10,000 cases in Edo. So 600 is not 10% of what we had. They were all going to Euro and UBTH because nobody wanted to come to our hospitals. Meanwhile, we have how many hospitals we say we have? 34. So this is the point I'm making. We cannot cover up. We are not doing enough given the investments we have on ground today. Right? Let us just accept it. In fact, COVID did not affect us because people don't even come to us. They go elsewhere. So that's the point you just made. Of over 10,000 people who were infected by COVID, you only treated less than 1,000, less than 10%. Meanwhile, you are the main hospital. You have the main hospital system in Edo State. So the citizens have moved on. They don't come to us anymore. So what he's telling me is technically today, I can switch off Ministry of Health and our hospitals and move everybody else to private clinics and be teaching. Nothing will change because we are not having any impact on our people the way we should. If I close down the Ministry of Health and move some of you to this private hospital and give them money, nothing will change because the patients were not anyway, they were seeking care elsewhere because they don't have any faith and confidence in us anymore. So why 4 hospitals? If majority of our citizens don't impact them,